So one more video. So we're going to talk about why or when you should come in for your carpal tunnel. Some people want to know how long is too long to wait. And what I tell people is you should come right in right away if you have constant numbness or deadness on your fingertips, because that could mean that you have some permanent damage to your nerve. So we should do an evaluation at least. And in most cases, if it is truly carpal tunnel, and you have constant numbness, we recommend you get that taken care of. If you have atrophy, meaning the muscle right here is wasted, or you see wrinkles there, and I'll do another video on that to show you some pictures of it. But if you see flattening or wrinkles in that thick muscle in your palm, on the thumb side of your palm, that means that the nerve is losing, or the muscle is losing supply through that carpal tunnel nerve, and it's causing it to get atrophied. And so you should come in and get that checked out. And then the next thing you should be concerned about is if you're waking up at night. Like if you're waking up at night every night, then that means you should probably come in to get it checked out. And we do a painless high-resolution ultrasound for diagnosis. It eliminates the need for that shocky, painful nerve test that takes months to get and cost a couple $1,000s. So you don't have to waste the money on a copay for that. The ultrasound test is about 10% of the cost of that shocky nerve test, and we do it right in the same visit. That way we get the diagnosis made and confirmed. And most of the time, carpal tunnel is a clinical diagnosis, meaning we could just diagnose it from your symptoms in your examination alone. And the cardinal symptom is waking up at night with numbness, tingling, and pain radiating into these three fingers. So you'll recognize that if you're waking up more than a few times a week with numbness and tingling, you should probably come in and get evaluated, even if you don't have constant numbness. The best time to come in is before you have constant numbness, because then the risk is minimal that you're going to have any permanent damage to the nerve. And so if you come in then, we can get you fixed and get you back to work in just a couple of days. If you're doing a light job, and a couple of days to a week, even if you're doing heavy things. We have hairdressers and dental technicians go back in 3 or 4 days after the procedure. And a lot of times we do both sides at once. And so we'll save you a ton of money, because most of the time people's deductibles are more than what it actually costs to get the procedure done here. And so if you go other places, it can cost you as much as $7,000 to $8,000, $9,000 with the facility fees for anesthesia in the surgery center or hospital. Here we get you done for a fraction of that cost, and we get you done all in one visit. So you're not visiting multiple facilities, multiple doctors to get those shocky, unnecessary nerve tests that are painful. And so those are the things that you should think about before you go to somebody for your carpal tunnel. You should think about how long it takes, how much it's going to cost, and when is the right time to go. And so what I would say is, if you're waking up more than a few times a week with numbness and tingling, pain into these 3 digits, or if you have constant numbness, tingling, or constant pain into the hand, you should come in and get that evaluated right away. So if you like this video, click like and subscribe, and come visit us at Carpal Tunnel Express. Thanks.